Today we will discuss the vertebral column. Vertebral column consists of 33 vertebrae, 7 of them cervical, 12 thoracic, 5 lumbar, 5 sacral fused together, and 4 coccygeal vertebrae forming the coccyx. The orientation of the spinal column, as we can see, it is kyphotic on the thoracic area and on the sacrum, and lordotic in the lumbar and cervical region. The classical formation of the vertebra consists of the following parts. This is the body of the vertebra. This is the body of the vertebra, and this is the neural arch or vertebral arch. This arch posteriorly, we call it neural arch or vertebral arch. The vertebral arch consists of two parts. This one here, the one here, this is the site where the arch attached to the body. We call it the pedicle, and the pedicle usually strong bone, very strong bone, and the continuation is the lamina. Here are the laminae. Okay, the laminae fused together in the middle. So this is the pedicle and this is the lamina. From this arch, there is 7 processes. This one, we call it the spinous process. This is the spinous process. These are 2, we call it the transverse process. 2 articulation above, we call it superior articular facets, and 2 inferior here, this is inferior articular facets. The vertebral body and the vertebral arch will form a vertebral foramen. The combination of vertebral foramen will form the vertebral canal. The pedicle is notched here superiorly and inferiorly. Inferiorly, here and here. There is a notch. So when these notch here, this is the inferior, this is the superior, this will form a foramen where the pin is going through. This, we call it intervertebral foramen for the passage of the spinal nerves. Each region had a special properties. Each region of the vertebral column has a special property. This is the cervical vertebrae, as you can see here. This is the cervical vertebrae. The cervical vertebrae, there is in the transverse process, there is a foramen here. In the transverse process, there is a foramen. We call it a foramen transversalum. And the spine here is bifid. The spine here is bifid. And the body usually small. The body is small, and the foramen, the vertebral foramen, very large. The superior articular facets here is the superior articular facets, this one, superior articular facets, facing upward and backward. The inferior articular facet facing downward and forward. We have 2 abnormal vertebrae. We call it the axis and the atlas. The first vertebra, this one, we call it the axis. The axis. As you can see, in the axis, just like an arch. It is like an arch, and there is no body here. Okay, just arch, and there are 2 masses, we call it the lateral masses, for articulation with the occiput and with the second vertebra. This first vertebra, we call it the atlas. The second vertebra, we call it the axis. This is the second vertebra. You can see from the body of the second vertebra, there is a protrusion up, we call it the odontoid process. This is the odontoid process. Articulate with the atlas, and this will represent a body of the atlas actually. This is a very important. This is odontoaxial joint. The seventh cervical vertebra usually has some criteria. This is the seventh cervical vertebra. We call it vertebra prominence because the spinous process is long. Usually the spinous process of the cervical vertebrae inclinated downward. As you can see, the direction of them are downward, but the number 7 is backward. The sacral vertebrae, the 5 sacral vertebrae, fuse together to form the sacrum, one bone. And there are an opening here, 1, 2, 3, 4. These openings are called anterior sacral foramen, and posteriorly we call it posterior sacral foramen, where the sacral nerve passes through. The laminae of the lower 2 sacral vertebrae not fuse together and form sacral hiatus. The sacral anterior border of the first sacral vertebrae protrude forward to form sacral promontory. Okay, and the coccyx is a group of 3 or 4 vertebrae fused together. Usually the first one is not fused to form the coccyx. The typical vertebra. The typical vertebra consists of 2 parts. This part is called the body of the vertebra, and this part here is the vertebral arch. The body of the vertebra is round, thick structure anteriorly, carry the weight of the body. The arch, vertebral arch, consists of 2 parts. This part of bone that attached immediately to the body of the vertebra, this part of the bone that attached immediately to the vertebra, we call it the pedicle. The pedicle. This pedicle, and continuation of the pedicle, there is the laminae. This is the laminae. The laminae is somewhat thinner bone than the pedicle. So the body and the vertebral arch, 2 parts, pedicle and the lamina. This hole formed by the body and the vertebral arch, we call it the vertebral foramen. The vertebral foramen. The collection of the vertebral foramen, one above the other, will form a tube-like structure where the spinal cord and the meninges pass through. There are seven processes attached to the vertebral arch. At the site of attachment of the pedicle here, this is the pedicle, to the lamina here, there are 2 transverse processes. This one labeled with red color. These are 2 transverse processes. At the site of attachment between the pedicle and the lamina. And where the 2 lamina fuse together, there is this projection, this one, we call it the spinous process or the spine of the vertebra, the spine of the vertebra. At the site of attachment of the pedicle to the lamina, there are two facets superiorly and two facets here inferiorly. Two, these attached here. I grasp them with my fingers and index fingers. Here are the inferior facets and here are the superior facets. The facets here covered with hyaline cartilage, to form the facetal joint. When you see here, this is the facetal joint. You can see the facets of the inferior facets of the above vertebra articulate with the superior facets here, the superior facets of the lower vertebra to form this joint. We call it the facetal joint. The site of attachment of the pedicle to the lamina, we call it the pars interarticularis. Here there is a notch superiorly in the pedicle. This is the pedicle, and here superiorly there is a notch. We call it superior vertebral notch, and inferiorly also there is another notch here. We call it inferior vertebral notch in the pedicle. This is the pedicle, and this is the superior vertebral, and this is the inferior vertebral notch. When you collect these together, these notches together, as you can see here, the notch the assembly of the inferior vertebral notch of the above vertebra with the superior vertebral notch of the lower vertebra will form a foramen. We call it intervertebral foramen here, where the pin go through, intervertebral foramen, where the spinal nerve pass through. Each side of the vertebrae, there is some characteristic criteria for those vertebrae. In the cervical spine, we can see that the body is flat. The body is flat, and the vertebral foramen is big and triangle in shape. This is triangle in shape. The transverse process had an opening. This is the foramen here, this one where the pin passed through, and this one here. We call it foramen transversarum. Foramen transversarum in the transverse process where the vertebral artery and vein pass through. Posteriorly here, the spine is bifid. The spine is bifid, and the lamina is very thin. Here is the C7. C7 has some criteria of the cervical vertebrae and some criteria of the thoracic vertebrae. The most important thing is that the spine of the C7 is very long. We call it vertebra prominence. This is very long spine, and this is the typical C7. This is the foramen transversarum, and this is the intervertebral foramen, triangle in shape, and this is the body. The lumbar vertebra, usually the body is very thick and strong. The laminae are thick, and the pedicles also very strong, and the transverse process are cylinder in shape, and the spinous process is somewhat rectangular. Superior facets, and this is the inferior facets.